Suboxone is a combination of two medications. This is buprenorphine and naloxone. The first ingredient, buprenorphine, is an effective first-line medication for treating opiate use disorder. It is a partial agonist opioid that binds to the opiate receptors in the brain. Buprenorphine helps prevent withdrawal symptoms, decreases cravings, and it helps prevent relapse by blocking other opiates from binding to that same receptor in the brain. It's usually a once daily medication, and because it doesn't fully stimulate the opioid receptor in the brain, there's no chance or a very low risk of feeling high while taking the medication. The second ingredient, naloxone, is used with buprenorphine to help deter abusing the medication. It has no effect, and it's not even absorbed when the medication is dissolved in the mouth. Instead, it helps prevent medication misuse by causing illness if the medication is injected, smoked, snorted, or taken not the correct way. Suboxone comes in two forms, films and tablets. Both versions absorb through the underside of the tongue and in the inside surfaces of the cheeks. Placement under the tongue is usually preferable, and that's what we like to use as most providers. Now, Suboxone cannot be absorbed through the stomach or the intestines, so the medication will have no effect if it's swallowed. It also must be fully dissolved in the mouth, and usually this can take up to 5 minutes, but most of the time it can be dissolved in 1 minute. Suboxone effectively treats OUD by allowing the patient's opioid receptors to be occupied with the buprenorphine. Remember, this is the partial agonist. Doing so alleviates withdrawal symptoms and cravings. Then, this allows the patient to spend less time worrying about the next hit, running out of medication, or finding the illicit substance, and instead they can focus on their relationships, their jobs, their family, exercise, and return back to their normal daily activities of living. Suboxone is highly effective in the treatment of OUD. A recent cohort stated that buprenorphine treatment after non-fatal opioid-involved overdose was associated with a 62% reduction in the risk of opioid-involved overdose deaths. Another study showed that of 40,885 patients or participants, only 1.7% of those individuals overdosed. And to be honest, very few medications have a success rate over 60% that we know of.